Have you ever heard this story? A 70-year-old man in Florida took his medicine faithfully every morning. But one day, he felt better and thought, maybe I don't need it anymore. Just a few weeks later, he was rushed to the hospital after a stroke. Does that sound familiar? Many adults over 65 make medication mistakes, sometimes with just one small decision, but the consequences can be life-changing. In this video, we're going to uncover 4 common medication mistakes after age 65 that doctors and health experts warn about. You'll learn why you should never stop your medicine without a doctor's advice, how mixing supplements with prescription drugs can be dangerous, and simple daily habits that can keep you safe and healthy. I'll share with you real patient stories, scientific evidence from the CDC and the American Heart Association, and practical tips that you or your loved ones can start using right away. So let's begin with point number 1. Why medication safety matters more after age 65. Part 1. Why medication safety matters more after 65. As we age, our bodies change. When we were younger, our liver and kidneys could process medicine more quickly. But after 65, things slow down. The liver doesn't filter as well, the kidneys don't remove drugs as effectively, and our blood vessels become more fragile. That means one pill that felt normal at age 40 could be too strong at age 70. Science confirms this. According to the CDC and the National Institute on Aging, nearly 40% of adults over 65 end up in the hospital each year due to medication mistakes or side effects. And here's the important part. Most of those hospital visits could have been prevented. James, age 72, was taking medicine for high blood pressure. One evening, he felt fine and thought, maybe I don't need this pill tonight. The next morning, he got so dizzy he fell in the bathroom. His doctor explained that skipping just one dose made his blood pressure swing out of control. Medicine is like a silent gatekeeper protecting your health. Just because you feel good today doesn't mean your body no longer needs that protection. Have you or a loved one ever thought about skipping a pill just because you felt better? Share your experience in the comments. You're not alone. Part 2. Mistake No. 1. Skipping or stopping medications without doctor's advice. There's one dangerous habit many older adults fall into: stopping their medication when they feel better. Sounds familiar? A lot of people think, I don't have symptoms anymore, so I must be cured. I don't need this pill. But the truth is very different. For chronic conditions like high blood pressure, diabetes, heart disease, or high cholesterol, medicine is not just for symptoms. It's to keep your body stable over time. If you suddenly stop, blood pressure can spike, blood sugar can swing out of control, or blood can clot more easily, all of which increase stroke and heart attack risk. According to the American Heart Association, stopping blood pressure medications suddenly can double your risk of stroke within just a few weeks. The CDC reports that one of the leading reasons seniors end up in the hospital is from abruptly stopping or not taking their medications consistently. And the Mayo Clinic reminds us, even if you feel fine, that doesn't mean your illness is gone. Your medicine is still quietly protecting you every single day. Mary, age 68, from Texas, had been taking statins to lower her cholesterol. After several months, her numbers improved, so she thought, I don't need these anymore. 3 months later, she was rushed to the hospital with a heart attack. Her doctor explained, high cholesterol has no symptoms, and stopping the medicine suddenly was the direct cause. Chronic medications are like a seatbelt, and you don't unbuckle your seatbelt just because the road feels smooth, right? In the same way, you don't stop your medicine just because you feel okay today. Have you or someone you love ever stopped taking a medication because you felt better? What happened afterward? Now we've seen how dangerous it is to stop taking your medicine on your own. But there's another common mistake: mixing prescription drugs with supplements or herbal remedies, without realizing how dangerous those interactions can be. Part 3. Mistake No. 2. Mixing prescription drugs with over-the-counter or herbal supplements. One of the most common mistakes older adults make is thinking, if it's natural, it must be safe. Because of that, many people take vitamins, herbal teas, or over-the-counter pain relievers along with their prescription drugs. But in reality, this can be a ticking time bomb for your health. Many supplements and herbal remedies can interact strongly with prescription medications. For example, O-ginkgo biloba, often taken for memory, can cause dangerous bleeding when combined with blood thinners like warfarin or aspirin. O-St. John's wort, used for mood, can reduce the effectiveness of heart medications, diabetes drugs, or even anti-rejection medicines. O-ginger or garlic in high doses, combined with blood thinners, can greatly increase the risk of bleeding. According to the FDA, more than 60,000 emergency room visits every year in the U.S. are due to interactions between prescription drugs and supplements or herbal remedies. The National Center for Complementary and Integrative Health, NCCIH, warns, natural does not always mean safe. John, age 72, had heart disease and was taking warfarin, a blood thinner. A friend suggested he drink strong ginger tea every day for better digestion and circulation. After a few weeks, he developed severe stomach pain and internal bleeding. His doctor confirmed it was the interaction of ginger with warfarin that made his blood too thin. No matter how harmless a vitamin, supplement, or herbal tea may seem, never combine it with your prescriptions without telling your doctor. Do you or a loved one take vitamins, supplements, or herbal teas along with prescription medications? And have you told your doctor about it? We've just seen how dangerous it can be to mix prescriptions with supplements or over-the-counter remedies. But there's another mistake that happens all too often: taking the wrong dose or taking medicine at the wrong time. Part 4. Mistake number 3. Wrong dosage or timing. In daily life, many older adults forget to take their medicine, or they take the wrong dose by mistake. Some skip a day and then make up for it by taking double the next day. Others confuse their morning pills with their evening ones. These may sound like small slip-ups, but they can lead to very serious consequences. In fact, this is one of the most common medication mistakes after age 65. Here's the science. As we age, memory declines and our internal body clock changes, making it easier to forget or mix up doses. According to the National Institute on Aging, as many as 25 to 30% of adults over 65 take the wrong dose at least once a year. Medications for blood pressure, diabetes, heart conditions, or blood thinners can be dangerous if taken at the wrong time. The results may include sudden drops in blood pressure, blood sugar swings, or even uncontrolled bleeding. Research published in the Journal of the American Medical Association, JMA, found that incorrect dosage or timing is one of the leading causes of emergency hospital visits among seniors. Alice, age 75, usually took her blood pressure medicine in the morning. One day, she forgot. That evening, she decided to take 2 pills to make up for it. The result? Her blood pressure dropped too low during the night. She became dizzy, fell in the bathroom, and ended up in the hospital. Doctors explained, blood pressure medicine must be taken steadily at the right times. You can't double up to make up for a missed dose. Think of your medication like a steady drip of water. It needs to flow evenly to keep the system stable. If the water stops and then surges all at once, it can burst the pipes. The same is true for your medicine. It must be steady, on time, and at the right dose. Have you or a loved one ever forgotten a dose and then doubled up later? Do you think that habit is safe? We've just seen how dangerous it can be to take the wrong dose or take medicine at the wrong time. But there's another mistake that's just as risky: going to multiple doctors without coordination and ending up with too many prescriptions at once, a problem known as polypharmacy. Part 5. Mistake number 4. Doctor shopping and lack of coordination between specialists. Many older adults in America see several doctors: a heart specialist, an endocrinologist, a rheumatologist. This is understandable. The older we get, the more health problems we may have. But the danger comes when no one doctor is watching over the whole picture. That's when patients end up with a bag full of pills, and no one checks if they actually work safely together. This is what health experts call polypharmacy, taking multiple medications at once. According to the Centers for Disease Control and Prevention, CDC, adults over 65 take an average of 4 to 5 prescription drugs each day, and about 4% take 5 or more at the same time. The Journal of the American Geriatric Society reports that polypharmacy increases the risk of falls, confusion, kidney problems, and emergency hospital visits. Without coordination between doctors, the risk of drug interactions skyrockets. For example, a diabetes medication can clash with a heart pill, or arthritis pain relievers can damage the liver or kidneys when combined with the wrong prescriptions. The National Institute on Aging recommends that every older adult should have a primary care doctor, someone to manage all prescriptions and communicate with specialists. Richard, age 79, had high blood pressure, diabetes, and arthritis. He saw 3 different doctors and ended up with 12 medications. After a few months, he felt constantly tired and dizzy, and one day he fell and broke his hip. At the hospital, doctors discovered he was taking 2 medications that overlapped in effect and others that created harmful side effects together. If he had one primary doctor overseeing everything, this could have been prevented. Your health is like an orchestra. It needs a conductor to make sure every instrument plays in harmony. Without coordination, the music becomes noise. Medications work the same way. You need one main doctor to guide and keep everything safe. Do you or a loved one take multiple prescriptions from different doctors? And is there someone in your family who helps keep a master list of all those medications? So now we've covered the 4 most common medication mistakes after 65: stopping medicine on your own, mixing prescriptions with supplements, taking the wrong dose, and seeing multiple doctors without coordination. Now let's bring it all together with a final summary and the most important message to protect your health every single day. We've just covered the 4 most common medication mistakes after age 65. 1. Stopping your medicine on your own when you feel better. 2. Mixing prescription drugs with supplements or herbal remedies without asking your doctor. 3. Taking the wrong dose or taking medicine at the wrong time. 4. Seeing multiple doctors without coordination, which often leads to too many prescriptions. And all of these mistakes have one thing in common. We think we're in control, but in reality, we may be putting our health at risk. Medications are not just for treating illness. They are the silent gatekeepers protecting your health every single day. Always keep an open conversation with your doctor, and don't hesitate to share a complete list of everything you're taking. Small changes, like taking your medicine on time, not skipping doses, and asking your doctor before adding supplements, can prevent major health problems like strokes, falls, or hospital stays. After 65, you can still live strong, independent, and full of energy, as long as you pay a little more attention to how you manage your medications. Of these 4 mistakes, which one do you or your loved ones struggle with the most? Share in the comments. Your experience might help someone else. If you found this video helpful, please hit like, subscribe, and share it with your friends or family. Who knows, your small action might protect someone's health or even save a life. Wishing you safety, good health, and joyful living at every age.